Tonight's World in Action deals with conditions in a mental hospital. Some people may find this distressing. Powick Hospital near Worcester, built like 100 others in this country by the Victorians for their lunatics. Today the high walls have been torn down. With modern drug treatments, most patients stay only a short time. But some stay forever, here, in these barrack blocks known as the Annex. Some have been here 40 years. Some younger ones have 30 years or more to go before they die. The Annex and the state of the people who live here are appalling.
Come on, Annie. Up you go.
Conditions like these exist in many but not all mental hospitals. Most comparable institutions would prefer to stay hidden. Powick didn't evade our inquiries, and the decision was surprising. For the hospital is ashamed of the Annex, and the conditions here are not wholly due to lack of money. In dealing with the problems, Powick seems to have become infected with the hopelessness of the Annex inmates. This is a record of one day's events in the worst ward of the Annex, Ward F13. Dr. Arthur Spencer, the Medical Superintendent, on conditions in his own hospital.
There are two possible reactions, I think, to your visit here. One is that people will become incensed about some of the members of the community having to live under these conditions. The other possible reaction is that people will be so appalled at what they see that they will shut it out of their minds and reject the whole problem as being insoluble and something which they can't face up to.
F13 stands for Female 13, an appropriately chilling title. They say if you don't die on 8, you die on 13. The patients are all female geriatrics. Some are physically ill, others are simply very old, shaky but still aware. Most are incontinent. You breathe urine all the time you're there. There are 78 beds, only inches apart. The baths are ancient and chipped. The edge of a lavatory seat is so worn it would scrape old skin.
Well, it's perfectly average mental hospital, similar to about 100 other hospitals in the country. It serves an area, namely mainly most of Worcestershire, and we receive here all the patients in that area who suffer from any form of mental illness and whose illness is of such a degree that they need hospital treatment.
7:30 a.m., setting off to face the day, which they started by sitting publicly on a pot, most without their teeth in or their specs on, most in hospital clothes and hospital underclothes, which were on someone else last week. Some wear name tabs on their wrists. Many have pudding basin haircuts. They are stripped bare in front of each other. Their bottoms are wiped in front of each other, and that, apart from feeding, is nearly all that happens to them.
Many of our long-term patients came in to the hospital before the days of very active treatments. They suffered from various diseases, but in addition, of course, they then became subject to the kind of life that lead in an institution like this. And at the present time, if one takes our very long-stay patients, it's extremely difficult to know how much of their condition at present is due to their original illness and how much is due to the institutionalization to which they've been subject since.
There's a television, a radio, and a piano. All day the old ladies just sit. Some of the nuisances spend hours locked in chairs like babies' high chairs. But most no longer have the energy to be even a nuisance. They're what's officially known as institutionalized.
One comes to accept the surroundings, so thing one can't alter.
Do you think you can do sort of good nursing in these sort of conditions?
One can do one's best, that's all we try to do.
It is second best, though, isn't it?
Well, it is second best, yes.
If one of my relatives came here, I wouldn't feel at all happy about it. And you found this with relatives, haven't you? They
Yes.
What's the reaction of many relatives coming here when they see it?
The reaction is partly guilt, but why should this happen to me? What have I done to deserve this? Or what's happened to my family, sort of style. And the other idea is that they're terribly ashamed of letting the neighbours know this has happened to them.
It's your birthday, Mrs. Wilson. A birthday card from Ellen, Kate, and Edward. To dear Mother, with all our love. Yes, it's your birthday, darling. Yes. Isn't that lovely? There. Isn't that beautiful? You going to keep it in front of you? There you are, my dear. Isn't that lovely?
A modern admission ward, 150 yards from F13. Here they work miracles with a Victorian institution. It's in wards like this that the main body of the hospital's work is concentrated, treating and curing short-stay patients.
Good afternoon.
Good afternoon, Doctor.
How are you feeling?
Oh, very well, thank you, Doctor.
Now, you've just come into hospital, haven't you?
Yes.
There is no smell. The colours are bright and modern. There are vinyl tiles on the floor. The atmosphere is hopeful and attentive. The treatment of short-stay patients eats up the money. Shock therapy, analysis, hypnosis, surgery, occupational therapy are all available, and Powick has made a name for itself in pioneering the use of LSD treatment. Once patients reach the annex, the battle is virtually over. The institution closes in around them. Powick's policy is to stop them getting there at all costs, and that leaves little for the people in F13. This is an occupational therapy unit. 150 yards away, the long-stay patients are left to vegetate until they no longer know how to do anything else. Powick spends £700,000 a year, most of it in an effort to get their short-stay patients home. It provides them with amenities it says it cannot afford for F13. Here, people are still people, women still women.
Nice light shade. You don't want too much because you've got a very fine skin.
F13, lunchtime.
I did not want chances.
You've got to have some.
I shall not.
You're going to have some.
Shall. I have good
Come on, darling. Here's a good girl. Come on, baby, sir.
No, you won't have some. Oh. No, Mary, I don't like it.
Why not?
I think it's too much. All right.
Where are you, Truder? Will you sit in your chair? You leave this little just over there and you can. Look, you don't hear yourself, don't make friends about. Oh. That's my pen, that is. La veis, Gustavo?
I have to.
Dr. Vijay Das, the ward doctor.
This part of the hospital is the bin, and people don't take too much interest in it, and somebody has to take a lot of interest to do things in this part of the building. But it is really terrible, and one of the diseases which we get often here is scabies. There has been a sort of endemic, all the time scabies going on in this hospital, and often about 20 or 30 patients in each ward. Just a few days ago, in the next ward, there were 20 patients of scabies. And this happens due to very poor hygienic conditions and overcrowding. It is often seen in the Oriental countries where there is very poor hygiene and overcrowding, which we see in this hospital, which shouldn't be there at all. And there is very few facilities for bathing to the patients. There should be showers in the hospital. There are baths in which 2 or 3 persons have to put a patient in and bath them, which is very difficult.
Well, this is England, and this is 1968. How do you feel as a doctor working in a ward like this?
This is really terrible, but I'm personally not working for a long time in this ward. I came only to work in this hospital for 6 months. I wouldn't like to work here anymore anyway.
Hey!